Welcome to the University Medical Center, home of the Reverend Avery C. Alexander Academic Research Hospital, and really home of a wonderful place. For those of you who haven't been here, this has really been ground zero of economic development in the past several years since Hurricane Katrina, and really a vital part of this city and an extremely important public investment and state asset. Our faculty, physicians, and staff that are part of this facility and were part of the interim LSU hospital before that and Charity Hospital before that have always provided outstanding care, and they now have a facility that's commensurate with their skill. So we appreciate you being here today to be part of this great event. Let me take a second and recognize some of our extremely dedicated state and public officials. We have State Representative Gary Carter here, Councilmember James Gray, Councilmember Latoya Cantrell, and Councilmember Nadine Ramsey. Thank you for being here. Jared Brosette. And Jared, let me apologize. I didn't recognize Councilmember Jared Brosette, and he has done so much not only for UMC and Children's Hospital in this community, so Councilmember Jared Brosette, thank you. You know, UMC fills a gap that no other hospital in the area can. And since opening, we've seen the number of patients increase here. We've seen our access increase, patient satisfaction scores and quality scores, all on the uptick. And we are excited. We're also the training ground for the next generation of physicians. We train over 900 residents a year, and they get life-changing experiences here. Our team here at UMC is really, they're on the front line of Medicaid expansion, and they see firsthand the struggles of the uninsured. Medicaid expansion will help the financial health of the state and the physical health of this community. It's why we are so excited to have the governor and the secretary here today to talk about Medicaid expansion. It was an historic moment when the governor signed Medicaid expansion in his first full day in office. It will dramatically change the lives of many in our community. The truth is, we all know people who will benefit from Medicaid expansion. They're the backbone of our economy, and they deserve to have health care coverage. In July, they will have health care coverage. It's simply the right thing to do for our state, our city, and our economy. Governor, we are proud to have you here today. You're part of our team, you're part of being a provider, you're part of our faculty, our residents, and the patients that we serve. And what you did in signing the Medicaid expansion into law will change lives. It's my privilege now to introduce Governor John Bel Edwards.
Thank you, Greg, and thank all of you for being here. And I'm going to make some comments to talk about Medicaid expansion. But sometimes we get lost in numbers. Are we going to save money? Is it going to cost us money? How many people are going to be enrolled? What does it really mean? So before we lose focus, I just want a few people to come up here so you can see the faces of Medicaid expansion.
Hard-working Louisiana residents are going to have the benefit of health care coverage with dollars we have already been paying to Washington. And we're going to bring those dollars home so that they can have that health care coverage, access the health care they need from providers who are going to be reimbursed for that care, and then they're going to work for employers who are going to have the benefit of a healthier, more productive workforce, and the state is going to save money, and they're going to have better health outcomes. What's hard about that decision? What is hard about that decision? God bless you. Thank you very much for being here.
Greg, thank you again for the introduction. I want to thank Dr. W. for a tour of this wonderful and magnificent facility that truly is worthy of the people of this part of our state, and really from all over the state who are going to access services here, but also those people who are going to work here and train here. I want to thank Dr. Gee for being with us today. She has done a remarkable job early in her tenure at the Department of Health and Hospitals. I know Ms. Ruth Kennedy is here. She's the point person in charge of Medicaid expansion, a national expert that we've had right here in Louisiana that we've been able to rely upon for the expansion. And while it isn't done yet, I know that we are where we are today largely as a result of your efforts. So I want to thank you, Ruth, for what you've done. I too want to thank Representative Carter for being here and so many folks from the New Orleans Council, Councilman Gray and Ramsey and Brossette and Cantrell. Thank y'all so very much for being here. I said it before, but I just want to reiterate this. First full day in office, I signed an executive order, not because it was a rash decision. I didn't wake up that morning deciding to do it. For 3 years, I filed legislation trying to force the Medicaid expansion because I believed it was the right thing to do for our state, for the people who needed coverage, for the employers who would benefit from our hospitals, doctors, and other providers. It just seemed like the right thing to do, especially since by opting out of the Medicaid expansion, we didn't opt out of the taxes that we were paying. Instead, our taxes were going to Washington and being sent to 30 other states, so that their working poor had the benefit of health care coverage, so that their providers got reimbursement, so that their employers had a better workforce, while ours went without. So I said it before and I'll say it again today. The easiest big decision that I will make as governor, I made on January the 12th when I signed the executive order for Medicaid expansion. And for me, this isn't liberal versus conservative, Republican versus Democrat. This is right versus wrong, not right versus left. And there is not a more conservative notion, though, than making sure you get the benefit of the tax dollars you're paying. And so we're going to start doing that effective on July 1st. Today is the first day of enrollment. And because of the expert folks that we have guiding us through this process, I can tell you that we have 175,000 people enrolled already. Think about that. And because of the assistance that we're getting from folks right here, for example, at this hospital, we're going to have between 5 and 9 people whose jobs it will be to interface with folks so that they can access Medicaid coverage through outstation people that are going to be here, sponsored by this hospital. And we have more than 100 providers around the state that are going to do that. You can access information about the Medicaid expansion through healthy.la.gov, and I encourage you to do that. We believe that the final enrollment figures are going to be somewhere between 300 and 375,000 people. And in the process of enrolling these people, faces of like you saw today, the state of Louisiana in the first year alone will save $184 million. Now, having inherited the largest budget deficit in our history at $2 billion, and having worked very, very hard, and we're not there yet, we have a lot of work left to do, we've whittled our deficit for next year down to $600 million. That $184 million in savings is critical for us to be successful. And we have a second special session where we are going to be more successful as well, so that we can make sure that we can stand by not just our Medicaid patients, but by their providers. Greg, we've got a lot of work to do, but we're going to get it done. So I just want to tell you that I am excited about this. And while I'm so excited about the news, the Medicaid expansion, the savings, the number of people, all of those sorts of things, at the end of the day, the task that I've given Dr. Gee is we're going to improve health outcomes in Louisiana. We want a better quality of life for our people. We want them to be happier, healthier, more productive people, and access to coverage where we can diagnose earlier, treat earlier, manage diseases better, and stop dispensing so much care through emergency rooms, where it is the most expensive setting to deliver care and the least effective way to manage health. So I'm excited about what we're doing. You know, it's been a very difficult challenge as governor over the first few months, and challenges remain, but we're doing some great things too. and I am so happy to be with you all here in New Orleans. And while we think we have about 375,000 people to enroll in Medicaid, 1/3 of that population comes from right here in this region. And that's why it's important that everybody in this room and everybody out there watching get the information that we're putting out there about Medicaid expansion, who's eligible, how they enroll, when coverage begins. And so I would just direct you again to healthy.la.gov to provide you more information. And if you don't see the information you're looking for, there is a phone number. You call that phone number, you will talk to a live human being, and they will guide you through this process. And this is an ongoing process. Even though enrollment starts today, coverage starts July 1st, over time, because people come of age, because people get employed or they lose employment, they will filter in and out of eligibility. And so it's important that we stay on this throughout, not just the next several months, but all the way through. And so this is a permanent feature, having these outstationed employees with providers to make sure that people are enrolling in the Medicaid expansion. So again, thank you very much for being here. I want to tell you what a blessing it is for me to be able to spend some time with you all and to look into the faces of people who are so excited and relieved about the health care coverage that they will have for the first time on July 1st. That's what this is about. And so I will be followed by Dr. Gee. If we can be of any assistance to you all, please don't hesitate to call on us. If you need something from me or my administration or DHH, whether it's Medicaid expansion or whatever, call on us. But before I give up the podium, I'm going to call on you to pray for our great state. I happen to believe in the awesome power of prayer, and I'm not just asking for prayers for myself, although those are welcome. I'm asking for prayers for our state, for all of our leaders, so that we can come together and make decisions that will best serve the people of Louisiana. Thank you all very much. God bless you.
Thanks, Governor. It's so exciting to be in my hometown today and to be standing here in the Reverend Avery Alexander University Hospital in New Orleans to celebrate a landmark step in our state's history. It's really apt that this building bears the name of Reverend Avery Alexander, as the old Charity Hospital did. Reverend Alexander committed his life to advancing justice in this city. He promoted his contemporary and compatriot, Dr. Reverend Martin Luther King. He proclaimed the moral imperative of opportunity and equality, that we must honor the humanity of all members of our society in equal measure. Among those dignities, Reverend Alexander and Dr. King recognized health care as a crucial component of the construct of liberty. As Dr. King said, of all the forms of inequality, injustice in health care is the most shocking and inhumane. While inequalities and injustices in our communities have continued to diminish over the decades, they persist under the surface, lurking only to be revealed in some of our most desperate hours. We saw many of these inequalities surface during the dark days of Katrina and the levee failures that inundated the ground we stand on today. The help and resources this community needed to weather the storm and floods frankly didn't live up to the task. Yet our community is resilient, both across the state and here in the city of New Orleans, and we would not let these tragedies sustain. Since the flood, through partnerships, collaboration, and innovation, this community has bound together and provided for those who are the most vulnerable. As we've rebuilt the physical architecture of this city, including this absolutely gorgeous building, we've also remade the healthcare spaces. Since the storm, this region has not just put together the broken pieces back together, but transformed and innovated in ways that celebrate ingenuity and broaden health equity. Whether it's the NOKI program, our providers and clinics that sprouted up to care for the primary care needs of the community, the Musicians Clinic, the Tulane clinics, the LSU clinics, or the beautiful new healthcare facilities, this facility, the beautiful new hospital in New Orleans East, the community health clinics that have grown up to meet the challenge of healthcare access. These have made an enormous impact and have transformed the face of this city to be one of the most beautiful and innovative in terms of healthcare in the world. And finally, I wanted to recognize the regional leaders, many of whom are here, the advocacy community, the provider community, and the leaders in the academic and civic spaces who for so long have fought for what the governor has said and acknowledged to be the most easy, difficult decision you'll ever make, a no-brainer from an ethical standpoint. And today is the day we've been waiting for. We've already had enrollees sign up, both through SNAP. You might have heard yesterday that we're the first state in the nation to use food stamps. to the food stamps enrollment program to be able to enroll people into Medicaid, which is fantastic. Coverage means a chance, as the governor mentioned, of health, not just health care for the state of Louisiana. Medicaid expansion in the spirit of Reverend Alexander's struggle opens doors, ensures access, and promotes equality. Now with access for more than 100,000 people in the greater New Orleans area, I challenge our providers to open their doors, put out their welcome mats, fill your facilities with hope and health. I'm proud to be here today and to, on this very, very exciting day. Coverage starts in July, but the hope starts today in terms of finally having access to care, not just partial care, but comprehensive care, medications, hospital stay, your primary care visits, all of that is now comprehensive health. So health is now your responsibility. You can no longer use the excuse of no health care access. Now you have to eat better, exercise, and take better care of yourselves so that we can be a healthier state, which is ultimately our goal.
Thank you, Dr. Keith.
And President Carter,
Welcome to New Orleans, Governor.
Thank you.
It's good to be home. I'm looking forward to another special session, though. I would just briefly like to reiterate some of the numbers that we talked about today. We're talking about 375,000 people who now have better access to health care. We're talking about tens of thousands of new jobs, approximately 15,000 new jobs in the state of Louisiana. We're talking about savings of significant money over a period of time in $184 million in this current fiscal year, I believe. This is a great day for the state of Louisiana. It's a great day for the city of New Orleans. And Governor, I just want to say thank you.
You're welcome. Thank you.